So we thought it'd be nifty to talk about a few case managers that we think we would most likely see, and we're going to start it off with a nurse case manager. So who are they? They are registered nurses that are responsible for the coordination of the various elements that are involved in the care of a patient. So how are they? They are at the very least, a registered nurse and not required to have a case management certificate, but it is desirable. And now insurance companies and hospitals are starting to require that certification. And also the job outlook. The U.S. Bureau of Labor Statistics state that it is believed that the RN case managers will see highly significant growth in the years to come. They base this off of the job growth of registered nurses. So examples of a nurse case manager, we hinted at it in the above slide of hospital and insurance. So we're gonna just talk a little bit about the roles that the nurse case manager might have in each setting. Also to note, a lot of the times the nurse case manager does work with the worker comp type of patients. So hospital setting roles, evaluating any patients that are admitted to the hospital. They're involved in preparation and implementation of care plans, both in terms of inpatient and outpatient care. Communication between patients, their families, and all external parties. And then the insurance company role, perform clinical and performance reviews, plan discharge of a patient, designs the care that is needed after discharge that is beneficial for the patient and insurance company. So now we're gonna get into a little bit of the social work case manager, because we just went over social workers. We thought it'd be pretty nifty to talk about these guys. So identification, the NASW defines social work case management as a method of service delivery in which a qualified case manager conducts assessments of clients and their families. Social work case management addresses not only the psychological and social needs of the clients, but also the condition of the social service system in which case managers operate. Their primary duty is to assess the strengths of their client individually and in the context of the care system that the client resides in. So a care system can be a hospital or an outpatient mental health facility, just for one example, just for a few examples. They also assess the barriers that prevent the client from obtaining ultimate level of functioning. A few examples could be medical conditions, lack of education, or economic issues. And so social work case manager, the Bureau of Labor Statistics does not classify social work as a separate occupation, which is the gray area because everywhere you look, there's the difference between a social worker and a case manager. But we just thought it'd be cool to state that the Bureau of Labor Statistics does not classify it as a separate entity. So the education of a social work case manager, which was touched on earlier today by Kevin and Kieran, but I'll just reiterate. They must hold a bachelor's or master's in social work from an accredited university and have at least 3 years and 4,500 hours of professional in an agency or organization that provides case management services. And they must possess a state social work license and adhere to NASW guidelines.
Not done yet. So, as the name implies, rehab case managers are probably what we will be working with the most. So what they are, they're trained professionals, and they help organize, plan, monitor, and evaluate services for patients in rehabilitation settings. It's important to note they do not provide direct patient care, but they work as part of the team, either like internally with like inside the clinic, or externally like as like working with the insurance company. They're both types of case managers are responsible for ensuring both quality and cost effectiveness of healthcare by advocating for the patient. Like Rocco just said, they're talking about rehabilitation nurses and clinical social workers. The rehab case managers are oftentimes one of those two to begin with. And it seems pretty obvious, but they work in hospitals, inpatient rehab, outpatient rehab, home health, private practices. So anywhere where we work, they will also be working. kind of like, so there's not like so many names, you can kind of like group them into different types of case managers. So the internal case managers, these are the ones that are going to be inside the facility that people work in. Their roles are very diverse, and they're quite diverse. And tasks range from clerical, maintaining reporting schedules, helping develop care plans, negotiating rates and lengths of stay with the external case manager, so the ones that work inside, they're like with insurance. And they provide no communication between all involved with the patient, and it's important to note that they, like, every type of case manager and all the PTs and everybody in the team are advocating for the patient's best care. So the external case manager, this type of case manager works with the insurance company to ensure quality and cost effectiveness. They help determine if the patient needs like an assistive device or any other means of adaptive equipment, or it could even like a different type of skilled rehabilitation services that may be necessary for the patient. I thought there's a quote from the Case Management Society of America talking kind of about these two, and I thought it was pretty interesting. It said they're most often the only party that is communicating with all stakeholders regarding diagnosis, treatment plan, and/or any activity need or report that is necessary to achieve the goals of optimum recovery of health and function. So that's referring to the two types of case managers here. So I'm not going to go too into depth with these different types until you already know these. So as you can see, you have the medical, mental health, substance abuse, clinical, legal, child, juvenile, geriatric, forensic, correctional. So as like these, you kind of know, you can kind of guess where you would see these type of workers. So this is another study we've done, and I just kind of realized it kind of like conflicts with the study that Kirtan showed earlier. But so this is oh no, the next one. So this is comparing internal versus external care management services in mental illness. And it was an RTC and qualitative study. So the study aimed to compare the effectiveness and integrated model, so the internal case managers, against a brokerage model is what they call it, which that basically means the external case managers, so the ones working with insurance. And this study, although it didn't have that many patients, it showed that there were no significant difference in outcomes or costs for the patients, whether they were working with an external case manager or an internal case manager. But the interesting part was that the worker dissatisfaction was much higher in the brokerage. So if you weren't like actually interacting with the case manager, there was a lot more dissatisfaction. Okay, so this next one, so this is again talking about joint working between health and social care. In this article, it was made by the NHS, and this was in the UK, and said basically what this study found that so that you can see where I'm really here. It says low indication that joint working delivers outcomes engaged in policy, but the whole article was kind of showing that like there's a lot of policy issues and there's not a whole lot of understanding exactly where their jobs lie and like what specifics. So so the NHS is saying that the UK needs to do some reform within these fields to kind of address some of the issues they have. Okay, this last article, this was a paper. This is a fairly old paper, but it was really interesting to me because it kind of looks on the opposite side of things. Like we were talking about working together with case managers for this entire presentation, but there's also challenges between working with them, and there's definitely areas where like they can improve on. So it says therapists and case managers are struggling to understand one another and still provide best treatment and equipment for their clients. So some of the challenges that us as PTs may have with case managers include that often they're not familiar with the rehab technology, and like since our field is like expanding and growing so rapidly, a lot of times they're not familiar with some of the stuff that we're doing and some of the reason why we're doing it. An example would be like a complex like patient case, like say you have a neuro patient or a spinal cord or something that they require different types of assistive devices or different types of rehab tools rather than just like a wheeled walker or something. Like a case manager might not understand exactly what it's used for and like why. Another challenge with these is sometimes the external case managers, because they're kind of not really there working with the patient, they may push for discounts on equipment or something without realizing the intensive service that's involved in the rehab that we are doing. And there's a limited rehab background for most case managers, and that results in a lot of times they don't really see the broad picture of what we're trying to get with a patient we're working with. So, a couple areas there for PTs. Now, for case managers, some of the challenges they face with PTs is there's breakdowns in communication between the PT, the case manager, and the patient sometimes. Case managers are kind of expected to be like experts of each particular field, but as you saw on our previous slides, there's so many different like ways they can be involved. So a case manager might not usually be in a rehab setting and be thrown in a case that is a rehab setting. So they're kind of expected to be experts, and they're not experts in the field. And that's kind of, again, going into this next one with the diverse background. So, and they are often forced to learn on the go. So, bridging the gap between the two, some like things we can start to work on to improve some of the relationships and have better off the interprofessional team, case managers and PTs. Building relationships and looking broadly at the different aspects that pertain to patient care. So we're trying to fit all the pieces together, which is important. PTs should approach new relationships with case managers expecting to help educate about different things that are new and that they may not completely understand in our practice. Provide an open communication line to discuss areas of concern or uncertainties between the two teams. And something like periodically offering educational services, like an in-service or something, would be really good to bridge the gap.
And then we have the Case Management Society of America, which is the CMSA. It's sort of like the NASW for social workers. It's an international nonprofit organization founded in 1990 and supports the profession of case management through educational forums, networking opportunities, legislative involvement. And the top priorities sought by the members include education, research, and networking. So you guys heard a lot about social workers and case management. So we thought it'd be cool to set up a little, almost like a little Venn diagram kind of deal to show some differences between the two. So the case managers, their education, it could vary between associate's degree or the bachelor's, but bachelor's required for the CCM certification. But remember that they are not required to be licensed or certified. The duties, they're kind of like the middleman between the client and provider. Completes a screening assessment to determine eligibility, which is the process. It's individual centered. Duties typically the same regardless of the caseload, like Mitch was showing, or described the multiple different forms of case managers and their voice. That ACMA is not as prevalent. This is due to the case managers having backgrounds such as in like nursing. The nursing case managers are represented by American Nursing Association. So social worker, education, they're typically a BSW or the MSW. Their duties offer a wide range of services, provide counseling if indicated. They go beyond the individual by investigating the social, emotional, and physical ramifications to the client's needs. And the